Hi, David McIntosh, paediatric ear, nose and throat surgeon. I'm going to talk about something that you may not initially think has got anything to do with ear, nose and throat, and that's asthma. Asthma is a disease or a condition of the lungs or the respiratory system. It's related to constriction of the breathing channels, usually in response to certain triggers, and it can be different in different people. It could be something that is an allergy, it could be cold weather, it could be exercise, it could be foods. There's a range of causes. What's really interesting is that there's a couple of ear, nose and throat conditions that feed into asthma. Now, the first one that we clued into quite some time ago was sinus problems. In patients that have sinus problems, there is an overrepresentation of asthma. And in those that have asthma, there's an overrepresentation of sinus problems. What's really interesting is that when we manage the sinus problems, whether it be with medication or surgery, the asthma control improves. So the medications for asthma actually work better. So this is really a big step forwards. But perhaps a bigger leap forwards came out recently with some research showing that managing children that snore and also happen to have asthma has a favourable effect not only on the snoring, but their asthma as well. There's research going around showing reduction in severity of asthma, reduction in presentations to the emergency department, reduction in the need of medications, and these reductions are in the order of around about 20 to 40%, so it's quite substantial. Another condition that can mimic asthma is reflux, and that's something that ear, nose, throat doctors will pick up at times as well. So in patients that have asthma, there's actually some guidelines now. Those guidelines include the fact that where you have asthma that's hard to treat, you need to look for any other underlying causes. In children and in adults alike, you need to look for allergy, and in children specifically, you need to look for mouth breathing, snoring, airway problems, trouble basically with their adenoids, their tonsils, hay fever, those sorts of things. So when it comes to asthma, it's not just about the lungs anymore. We take a holistic approach to look at everything that's involved and try and get some answers as to any underlying or contributing factors. Have a nice day.